Hello friends, good morning and welcome to a new sofa session here at Siwi at the World Water Week in Stockholm. So the name of this session is Climate Change and Social Inclusion in Sanitation, and we're going to be discussing the issue of climate change. I would like to introduce to you Ms. Juliette Willets. She's sitting next to me. Welcome, Juliette.
Thank you.
She is the Professor and Director of Research on Water and Sanitation Services in Asia and the Pacific. She's based at UTS, the University of Technology in Sydney. So, Juliette, who is sitting at the sofa with us today?
So firstly, we have Peter O'Connor. He's the Director of Water, Sanitation and Hygiene Section in the Australian Department of Foreign Affairs and Trade, who makes significant investments into water and sanitation and also to water resources management. And then we have Antoinette Combe, and she is the Global Wash Sector Coordinator for SNV Development Organisation, and she looks after teams across about 20 countries. And then we have Dennis Malambo. He is Director of Commercial Services at the Lusaka Water and Sanitation Company, which is based in Zambia.
Wonderful. Welcome, all of you. So, Juliette, will we be talking about water or sanitation in this session, and why?
So we're absolutely going to be talking about sanitation.
Okay.
There are 4.2 billion people without access to safe services, and climate change is only going to make that much harder. So water and climate change have already receiving quite a lot of attention, but not yet sanitation. There are 112 countries that are off track to meet the Sustainable Development Goals for sanitation, and actually a quarter of those are slipping backwards rather than moving forwards.
Wonderful. Why are you bringing together research, implementers and donors to this debate?
Well, given the urgency of the crisis, we think that all development actors are needed, each with a different role, and to tackle the costs and the trade-offs. No one can contribute usefully alone, and we need both mitigation and adaptation options. On mitigation, emerging evidence shows that actually sanitation may be making a much bigger contribution to greenhouse gases than we've previously realised.
I see. So how you mentioned this is about sanitation. So how are sanitation services affected by climate change? Can you provide examples?
Sure. So there are really four very direct impacts, and those are from storms, from droughts, from sea level rise, and from floods. So if we start with the first of those, storms are going to damage infrastructure. They're going to stop power supplies. In Hong Kong last September, there was a typhoon which damaged the wastewater treatment plant, and it resulted in about 8,000 metres cubed of raw sewage entering the environment. On the second point, on droughts, it makes flushing toilets unusable. If there's no water, you can't flush. Or it means that women are left carting water, such as in dry areas of eastern Indonesia. Also, if you don't have much water use, how is your sewage going to flow? On the third issue of sea level rise, wastewater treatment plants are mostly at the coast, on the edge of the land, and they get subject to inundation and to corrosion. And last, but really not least, is the issue of heavy rain and floods, which we know are predicted to increase in many places. So these are going to cause challenges for disease spread. In the US, in England and in Wales, cryptosporidium outbreaks have been associated with extreme events and floods. So if we don't focus on sanitation, with these increasing storms, droughts and floods, infectious diseases are only going to spread and increase. And on the flooding, I think maybe Dennis might have something to add.
Yeah, Dennis?
Indeed, in Zambia we haven't been spared at all. For example, like Lusaka. Lusaka is basically sitting on limestone. So with the events of these flooding events, it's really had a negative impact on public health, more especially when you look at pit latrines. So what usually happens is when these floods come in, the pit latrines get overflooded. So you'll find that all the fecal matter gets to flow in the stormwater. So this really has a negative impact. I'll give an example, like in 2017, 2018, we actually had an outbreak of cholera, which saw about 5,000 cases being reported and almost 100 deaths. So really the impact is there.
Yeah. Peter, who is most affected by this, and could you provide some examples?
Sure. Well, it's as always, it's the most marginalised. It's the poor communities, rural communities, Indigenous peoples, women, people with disability, the aged, the people that are excluded from the decision-making processes of their society. people that live in the most marginal locations, they're usually the worst served by poor quality infrastructure. That's if they have infrastructure. And what that also means is that they're also the most vulnerable to climate disasters and climate shocks. As Juliet says, floods, droughts, cyclones. And when they hit, they're also the groups with the least resilience, the least ability to bounce back after disasters. They're the groups that get the least attention in terms of resources and that sort of thing. They're the people who get the least out of society, but will always pay the highest costs.
Yeah, so that's like last year in one of the cities where we work in Tanzania. So there were these big floods and you had destruction of assets and displacement of people, sewers overflowing and stormwater drains damaged and toilets, of course, are also overflowing. And then for the households that had latrines in the low-income settlements, those latrines practically became unusable and sometimes there was a danger of collapse. So all these people reverted to open defecation in a city of 700,000. A large part of the population reverts to open defecation, and it's the most vulnerable people.
Thank you, Antoinette. Antoinette, is this issue being addressed by policy?
Well, for me, it's hard to see beyond the discourse. There's a lot of talk about the win-win solutions in climate change, and there's much less talk about the trade-offs and the choices that we need to make. Because ultimately, in sanitation, this is about the functionality, the quality and the continuity of those sanitation services. And as Juliet was explaining, with climate change, there's going to be an increased rate of failure of sanitation services. So who is affected? What you're seeing is that the big assets, like the big sewer systems, will require quite a lot of investment in order to make those climate resilient. This is money that can't go to people who are not connected to sewer. And what about their resilience? So we really need to talk about those trade-offs and make explicit choices.
Yeah. So, Peter, what about donors? What is their main concern?
Well, as Antoinette said, in terms people understand, it's the costs. The costs, financial costs, economic costs, and probably most profoundly would be the human costs. Good sanitation underpins really all aspects of human development. I do think that there's a real fear that we will go backwards in many countries, in many areas, amongst groups, peoples, like I've said, will go backwards in sanitation. If we go backwards in sanitation, then we go backwards in health, we go backwards in education, we go backwards in all aspects of human development. The sorts of investments that have already been made, we go backwards in that. So then you've got to make up the costs again, and then you have to rebuild on that. So the economic costs are enormous, financial costs, but really it's the human costs will be incalculable. Yeah.
Right. Dennis, from a service provider's perspective, why don't you share with us the challenges that you face, maybe through an example?
Yeah, on one hand, we are faced with dealing with the uncertainties of climate change. Whereas on the other hand, we still have this pressure of getting to more people, increasing coverage, getting to lay new networks, getting to build more latrines. So juggling between the two makes it become more difficult for utilities. The other aspect really is also the urgency that we need to upgrade these toilets, more especially in the peri-urban areas. So that is really putting a lot of stress on the utilities, both financially but also from a political sense of view. Then the other thing that I could really talk about is really the challenge with the recurring electricity shortages. With climate change, most of our power is hydro. So with increasing climate change, we find that there are a lot of these electricity shortages, and you would find that equipment such as for running our pumps, for running our facilities, is in short supply. So it really presses a lot of stress on the utility in terms of running the utility.
And what about solutions? What do you see as solutions then?
I think the major solution really is to have robust, climate resilient infrastructure. Yeah. I think that is key, and that is really number one. So really, I think there will be trade-offs, really, because this infrastructure will definitely be more expensive than it would to deal with ordinarily.
Yeah.
Then also, there's this challenge really of having to retrofit, because now you have infrastructure that you've already constructed, but now because of these climate issues that are coming about, you need to retrofit these issues. So that needs to be done. Then also, really, the actors that are involved, really there should be an integrated approach from everyone, from all the players, donors, implementers like ourselves. We really need to come to the table and work together and pull in the same direction. For us as Lusaka Water and Sewerage, really, we've gone further, really, to now starting to look at, including, these solutions into our master plans. Mm-hmm. That way, we'll be better placed to advise donors where to get to invest when they are looking at infrastructure. But also, what we've done now with the help of GIZ, they came up with a tool. It's called an ECAM tool, which basically looks at energy efficiency, but also at carbon emissions. So with this tool, we've actually applied it to the entire service chain, mm-hmm. both on our water supply, wastewater, but most recently even on the fecal sludge management. So with this, it gives us a better picture on where really the problem is lying. So that way we'll be able to advise the donors and anyone else who comes to the play on how best to invest.
Thank you, Dennis. That's quite clear on your side. Antoinette, what about development agencies? What are the main challenges for them to build local capacity in this field?
Yeah, the thing is, there's few utilities like Lusaka Water in low and middle income countries, because Lusaka Water is responsible for water and sanitation, not just for water and sewer. Mm-hmm. And that means looking at the entire city. But most cities in developing countries, what we see is that 90% of the population that is not connected, nobody is really responsible for those sanitation services and for the continuity of those services, except the households themselves. Mm-hmm. And so there's no long-term planning, there's no preparedness or investments in the resilience. And as a sector, I feel, as a sanitation sector, we're really quite immature in that sense to be prepared to provide services in the first place. Mm-hmm. So then talking about citywide services with local authorities, for example, is a novel thing in itself. For us, then the challenge is how to go step by step and align with or consider the absorption capacity of people and the need to have inclusive decision making, while at the same time the urgency is there to act on climate change and be prepared.
Wonderful. So, Juliet, just to finish, what would you like our audience here and an audience online to do with the information that we just discussed?
Yeah, sure. So really we'd like to make a call to action to donors, to governments, to development agencies, to service providers, and also to researchers. Despite being so fundamental to daily life, water and sanitation services, and particularly sanitation, they're missing from broader climate discussions. They're missing from adaptation planning and financing. Mm-hmm. And so we really need, amongst things, we really need to address the lack of research on the topic and provide an evidence base for the decisions, for the hard questions about the different costs and trade-offs that we've just been talking about. And we haven't even touched on some really big research gaps, such as antimicrobial resistance and the links to climate change and sanitation, and the major gap in understanding anything about emissions from sanitation systems. But many of us are moving forward on this. Australia and other donors are starting to support climate resilient sanitation programming, and with SNV and with the World Health Organization, we've been developing publications that are about how to integrate climate change into sanitation. And service providers like Lusaka Water, as we've heard, they provide examples of a way forward. So really we do call on everyone to act together on this, to draw on this start. And what we understand is the theme next year for Stockholm is on climate change, and we really hope that we've got significant progress to show on these issues by the time that comes around.
Let's hope so. So thank you very much, Juliet, for joining us today. Thank you, Peter. Thank you, Antoinette. Thank you, Dennis. I guess I'll see you around, and I'll see our audience next time at the next sofa session in a couple of minutes. Have a good day.
Yes.